The year is 1918. The world is engulfed in the fiery chaos of World War I. Millions have perished on battlefields across Europe, but a new enemy is emerging, a silent and invisible threat, the Spanish flu. Imagine a world at war, already grappling with unimaginable loss and suffering. Now picture this: a relentless wave of illness sweeping across continents, leaving a trail of death and despair. The war-torn nations, exhausted and depleted, now faced a new and terrifying adversary. The flu struck swiftly and without mercy, spreading like wildfire through the trenches, battlefields and war-torn cities of Europe. Despite its name, the Spanish flu did not originate in Spain. Spain was one of the few countries that reported on the outbreak openly and honestly. Wartime censorship played a significant role in downplaying the severity of the outbreak in many nations. Governments were reluctant to admit weakness or sow panic among their citizens. Spain, neutral in the war, had no such restrictions on its press. Spanish newspapers were free to report on the outbreak, leading many to believe the flu originated there. Thus, the name Spanish flu stuck, a lasting reminder of the power of perception and the unintended consequences of wartime secrecy. The Spanish flu was unlike any influenza outbreak the world had ever seen. It emerged in the final year of World War I, a time when the world was already in turmoil. It infected an estimated 1/3 of the global population, spreading rapidly across continents and oceans, leaving no corner of the world untouched. What made this flu particularly terrifying was its predilection for healthy young adults. Unlike typical flu strains, which primarily affect the very young and the elderly, this virus targeted those in the prime of their lives. Typically, influenza poses the greatest threat to the very young, the elderly, and those with compromised immune systems. But the Spanish flu defied these norms. Imagine this: young soldiers full of life and vigour struck down in their prime. These were individuals who had survived the horrors of war, only to be felled by an invisible enemy. Families torn apart, not by bombs and bullets, but by a microscopic enemy. The grief was palpable, as communities mourned the loss of their young and healthy members. The Spanish flu triggered an overreaction of the immune system, a cytokine storm, which proved particularly deadly in those with the most robust immune responses. This overreaction caused severe respiratory distress and often led to death. The 1918 pandemic was a stark reminder that even in the prime of life, we are all vulnerable to the forces of nature. It reshaped societies, altered the course of history, and left an indelible mark on the collective memory of humanity. The Spanish flu was a brutal and unforgiving killer. Symptoms often appeared suddenly and escalated rapidly. Imagine this: your lungs fill with fluid, your skin turns blue from lack of oxygen, and you struggle for each breath. The virus attacked the respiratory system with a vengeance, leaving victims gasping for air and their loved ones helpless. Doctors and nurses, overwhelmed by the sheer number of cases, worked tirelessly to treat the sick. Hospitals overflowed, and makeshift infirmaries were set up in schools, churches, and even private homes. In 1918, the world lacked the advanced medical technology we rely on today. There were no vaccines to prevent infection, and antiviral medications were still decades away. Quarantine became the primary weapon against the spread of the virus. Schools, churches, theatres, and other public gathering places were shuttered. Masks, often simple cloth coverings, became a ubiquitous sight. The world of 1918 offers a glimpse into our own recent past, where social distancing and mask-wearing became part of our daily lexicon. The 1918 pandemic threw the world into chaos, disrupting daily life and overwhelming healthcare systems globally. Hospitals, overwhelmed with the sick and dying, resembled war zones. Makeshift wards were set up in schools, churches, and other public buildings to accommodate the influx of patients. Doctors and nurses, exhausted and emotionally drained, worked around the clock, often without adequate supplies or protection. Their dedication and sacrifice were nothing short of heroic. Outside the hospitals, fear and panic gripped communities. People wore masks, avoided public gatherings, and lived in constant dread of the invisible enemy. Streets were eerily quiet, save for the rumble of horse-drawn carriages carrying the dead to mass graves. The silence was a stark contrast to the usual hustle and bustle of daily life. Governments struggled to maintain order as misinformation and fear fueled rumours and conspiracy theories. Public trust in authorities waned, complicating efforts to control the outbreak. The Spanish flu left an indelible mark on the world, not only in terms of lives lost, but also in the collective trauma it inflicted. The lessons learned from this pandemic continue to resonate today. By the time the Spanish flu subsided in 1919, it had claimed an estimated 50 to 100 million lives worldwide. This staggering loss of life was unprecedented and left a deep scar on the global community. The exact death toll remains uncertain, a testament to the chaos and inadequate record-keeping of the time. Many records were lost or never properly documented, adding to the mystery and tragedy of the pandemic. The 1918 pandemic served as a harsh wake-up call for the global community. It exposed the vulnerabilities in our public health systems and the need for better preparedness. It highlighted the importance of public health infrastructure, disease surveillance, and international cooperation in combating infectious diseases. Public health campaigns became more widespread, emphasizing hygiene and vaccination as key preventive measures. In the aftermath of the pandemic, nations invested in public health research and established organizations like the World Health Organization. These efforts laid the groundwork for modern epidemiology and global health initiatives. Despite the profound impact of the Spanish flu, it has largely faded from public memory. Memorials and ceremonies were held, but over time, the collective memory of this devastating event has diminished. We must honor the millions who perished and acknowledge the sacrifices made by those who fought the pandemic on the front lines. Their bravery and dedication laid the foundation for the advancements in public health that we benefit from today.